Hi, everyone. This is Dr. 𝘿𝙧 Dr. D, Q&A with Dr. D. And today, guys, I am talking to you guys about the elbow. 1 second as I get set up here. Hope everyone is doing well. Guys, I'm doing a little bit of a new setup today. Wanted to show you guys some anatomy. So just setting that up and getting set up on Instagram. Hey, Joanne, how are you? Hope everything is well. Hope everyone on Facebook is doing well. Hope everyone on IG is doing well. Joanne, thank you for joining. Guys, we're continuing with our conversations about everything elbow. And today we're going to be talking about something that has probably happened at one point, which is you probably banged your elbow against something and you felt that nice zingy or nervy sensation going down your arm. What is that? Why does that happen? So I'm going to talk about that and talk about the biology behind it, the anatomy behind it, and talk about some of the common things that actually can happen in relationship to that sensation and those structures that can be affected. So I hope everyone is well. On Facebook, you guys are going to be seeing a little bit of anatomy. On guys on IG, I'm going to try and let you be able to see that also. So I'm going to switch this around. Let's see. And hopefully you guys can see my screen. Joanne, you are online. Tell me if you can see this screen, if you can see me and you can see the screen. Can you see that? Just give me a thumbs up if you can see it, or let me know yet. Or just say yes so you can tell me that you can see it. All right. Awesome, awesome. So we are going to get started. So today, guys, we're going to talk about that sensation that you feel, okay? So that sensation that you feel when you've banged your elbow against something and you feel that zinging down your arm. That zinging down your arm, guys, is really referring to the sensation that you get in terms of nerve pain, okay? There is a nerve, and if you guys look at the screen, I'm going to shift it over here for those guys on IG. All right, right over here. All right, so those guys, so when you're looking at the anatomy of this, guys, there is a nerve that sits right on the base of the elbow. This is showing a picture right at the inside part of the elbow. I'm going to turn it around to the back area. I've enlarged it quite a bit, as you can see. And this nerve that's going to be highlighted right here is called the ulnar nerve, guys, okay? And as you can see, the ulnar nerve sits in a really, I'm going to try fade everything else so you guys can see how it kind of runs along the arm there, okay? And it runs basically on the inside of the arm, guys, all the way down. If I were to go back a bit, okay, and take away some of the muscles, you can see that it runs all the way in that little bit of a curve right there. So if you look at your elbow right now, guys, that point right on the inside is where that ulnar nerve runs. And it's something that we call, it's very superficial, meaning that it's very close to the skin. It's not buried deep within the muscles. And for that reason, it's very vulnerable and it gets very commonly injured because it's very easily accessed from any external force or any external pressure. Okay, so there's a lot of times that, you may be walking around, you bang your elbow and you feel that zing down your arm. It's because that nerve is just very superficial and very easily accessed. Now, there are a couple of actual conditions that can be caused not only by just zinging the nerve, but if you have consistent compression on that nerve, you can start getting a couple of symptoms, all right? And the symptoms that you usually can get with this is something called cubital tunnel syndrome. Cubital tunnel syndrome deals with compression of this nerve right in this area. This is called a cubital tunnel, all right? And that's where that nerve lives. And if you have had any sort of compression or prolonged stretch to that nerve, You can cause numbness and tingling down the arm that radiates into the hand. Anytime that you get compression of the ulnar nerve, you would find usually the pinky and the ring finger starts getting involved in terms of getting those very specific numbness and tingling sensations, okay? So if you guys are kind of looking at that information, or you're noticing, you know, that there are numbness and tingling sensations in your hand, if it's on the outside of the hand, those two fingers, those two lateral fingers, depending on how severe it is, it may get into the third finger, you are looking at some sort of compression of the ulnar nerve, okay? So a cubital tunnel syndrome, again, if you've had some sort of weird bang into that area, or let's say you've been sleeping for a long time and you've been sitting in that position where that nerve is going to be stretched in that area. And I'm going to shift this over here so you guys can see me also. All right. If you've been sitting in that area and you find that that nerve can be stretched and you've been sleeping in this position, a lot of people sleep in that position. Or if you've been on the phone and you've had your hand to your ear for a very long period of time, you will notice that you've got a lot of prolonged stretch through that area, and you will see that sometimes you can get that characteristic numbness and tingling into your hand. When that gets really severe, it can affect the muscles on the inside of the forearm, which is generally the flexus, because that's where that nerve runs, as you can see. I'm going to put some muscles back on this model here, and you will see right there. Shift this over to the side so the guys on Instagram can see. Right in that area lies the flexors of the forearm. And those are the muscles that are encased in that ulnar nerve as it comes through there, okay? So very interesting case, guys, where you can really see, depending on what part of the body or what part of the body is being stressed or what part of the nerve is being injured, you can start getting compression syndromes in the forearm that kind of go all the way down to the arm. Another one that I want to talk about, guys, that's not particularly common, but it becomes a little bit more of a concern when we're talking about wrist issues, is when we're talking about pronator teres syndrome, because that is compression of the median nerve that happens a little bit higher up in the forearm, right in this area, compared to compression more distally or lower down in the wrist area, which is called carpal tunnel syndrome. And carpal tunnel is something that you guys hear a lot. Guys, it's really important to get a differential diagnosis with this because, again, there can be compressions of the same nerve in different locations. So it's important that you get a really good clinician that's able to differentiate between carpal tunnel syndrome versus pronator teres syndromes, because they can reproduce the same exact symptoms, okay? So just to give you a little bit of a visual of what that looks like, here you have the pronator teres, okay? And that muscle, when that muscle becomes very tight, if it becomes very tight, and this is really specific for people who are doing a lot of forearm work. So for example, tennis players, carpenters, mechanics who are doing a lot of screwing. The pronator teres is responsible for the rotational components of the forearm. Okay, so that rotation, or what we call pronation, which is turning your palm from right above all the way down. And that motion, if you find that you're doing a lot of those motions specifically with a lot of force, repeatedly over time, you can find you can get really tightness of this muscle that now starts compressing the structures all the way below. Okay. And again, if we take away some of these muscles right here, one more layer, that nerve right there is the median nerve that you can see that runs all the way down into the hand. Okay. So with this illustration, guys, you're going to start getting a very clear indication of some of the things that can happen with the forearm in terms of numbness and tingling. Okay. Sometimes it's produced at the elbow. Sometimes it's produced a little bit lower down. So it's really important that you guys get a very clear understanding of where the compression is coming from so that you're seeking the right treatment. There are lots of times that people actually have compression of the median nerve, as I talked about a little bit higher up here, higher up, that's not coming from the wrist, and they are still diagnosed with carpal tunnel syndrome. So they go through the protocols for carpal tunnel syndrome and find no relief because those symptoms were actually originating and getting compressed higher up. And when we get into carpal tunnel syndrome, and we'll talk about that next week a little bit more, it can get very severe. If symptoms are severe, sometimes surgery is recommended. So guys, you don't want to go under the knife unless it's absolutely necessary. So make sure that you are getting some really clear guidance on exactly what is causing your symptoms, and then seeking the appropriate treatment for that. Okay. So guys, I really was interested in giving you guys a really nice visual of what's going on with the nerves and what's going on again with any sort of numbness and tingling that happens in the forearm. It happens more frequently than you think, specifically with a lot of overuse injuries. That particularly can happen. People who do a lot of typing, people who do a lot of lifting, specifically with their forearms and their wrists, can really start triggering a lot of these injuries. And you would be surprised how many people do have underlying issues with their nerves being compressed and causing issues within the forearm and also into the wrist and into the hand. Okay, so I'm gonna check the comments right now to see if anyone has any questions. Hey Al, how are you? Thank you for joining. If you have any questions regarding nerve issues in the forearm or into the hand, because it's difficult to peel them apart, but I'm trying to do this just for the sake of these lives. But if you have any questions about that, let me know. Drop it in the comments. I'm happy to answer for you. Okay. And I'm going to see if I can check Facebook here, guys, because I'm doing the illustration, the anatomy illustration. I'm hoping to see comments online also. I'm going to turn this around on IG. Place this here so you guys can see me. Any questions, guys, that are coming up with that you can think of? Let me know your thoughts. Is this helpful? Have you experienced some sort of issues with your forearm before? Have you noticed anything going on? If there's anything that you want to ask me, please feel free to ask me in terms of that, or drop it in the comments, or send me a private message if it's something of a more personal nature. Okay. Good. Awesome. So guys, that kind of concludes the conversation for today. Tomorrow, let's talk about tomorrow. Tomorrow, I'm going to be having a great friend of mine, 𝘿𝙧 𝘿𝙚. He is a physical therapist. He works a lot with golfers and with overhead athletes. He's an amazing guy. And I wanted to bring him on to talk about golfer's elbow. Okay. So yesterday we talked about tennis elbow, which is on the outside. Tomorrow, we're going to talk about golfer's elbow, which is on the inside. And then coming up on Friday, we're going to be going over some great exercises that you guys can start implementing. If any of these conditions apply to you or a friend or someone that you care about, ask them to tune in on Friday or tag them in that live. I'll be going over lots of exercises that's going to be helpful for loosening up and also strengthening and stretching this area so that you are having a lot less issues with your elbow. And with the elbow, again, as I said before, if you haven't heard the lives before, please go back. It is multifaceted. It has to do with what's happening up here in the arm, but also what's happening in the forearm, because it's the middle child. It's a joint in between. So it's really important to address the structures above and below. Okay, so I hope that was helpful, guys. Again, drop any comments or any questions that you may have, and I will talk to you guys tomorrow, 4 p.m. with Mr. 𝘿𝙧 𝘿𝙚, good friend of mine. Make sure you tune in for that. Okay, bye, guys.